Medicare has many parts, A, B, C, D. This video addresses Part C, a third in a series of 4. Welcome, I am Martine Bruce, your medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So what is Part C? What does it cover and for how much? What are the advantages and problems? And as always, I'll share some tips to help you along. First, let's clarify. Part C is a different type of Medicare plan that does not affect those of you who have original Medicare plans with a supplemental. Do watch my videos on Part A and B for more details on this type of plan. So Part C is called Medicare Advantage or MA. With this plan, you turn over your Medicare premiums and rights to a private insurance company that manages your benefits and pays your claims. This works the same as if you still had a commercial insurance. You may have Medicare coverage, but you don't have technically Medicare. Instead, you have United Healthcare, Humana, Aetna, etc. While that private insurer is required to cover the same range of services that original Medicare pays under Part A and B, that insurer can now decide if, when, and how you access medical care and whether a claim should be paid. So what is covered? Well, Part C must cover the same level as Part A and B would, with the exception of hospice services. Those will always be paid by original Medicare Part A, even if you have a Medicare Advantage plan. As for Part D, prescription coverage, it's usually included with the Advantage policy. And many such plans will also include vision, hearing, and dental benefits. What are your costs? Well, like everything in healthcare, it depends on the type of plan you pick, the type of service you need, and on the status of a provider who performs the service. Medicare pays a fixed monthly premium for your care to the private insurance company holding your Advantage plan and imposes a maximum yearly share of cost. But it is up to that carrier to decide how to charge you for those services. You may also need to pay additional premiums for vision, dental, and prescription coverage. And whether you pay higher premium now or higher copays later will also affect your cost. There are 5 plans to choose from. 2 are popular and available. HMO, the Health Maintenance Organization Plan, works as in commercial areas. Patients must use a very limited local network of contracted providers. A PCP, primary care physician, manages all of the medical needs and care of a member. That same PCP issues referrals to specialists for services he or she cannot render. There are usually no out-of-network benefits except for special circumstances like emergencies. In a PPO plan, preferred provider organization, patients have the freedom of choosing providers from a larger network, and out-of-network benefits are usually available at a cost. Patients administer their own care, mostly without pre-authorizations. The private fee-for-service plan works almost the same as the PPO plan, except that it may allow members to use the huge national Medicare network instead of or in addition to their own. The Medical Savings Account Plan, MSA, has 2 parts, a high deductible policy and an MSA account, which is similar to an HRA or HSA account. Medicare funds the savings account with a portion of a high deductible. Once you pay off the rest of that deductible, the plan covers your expenses at 100%. You can use the funds in the savings account towards the deductible or to pay medical expenses. And you can even use those funds for non-medical expenses, but then the IRS will want to know. Enrollment is restricted, but if eligible, you can use the vast national Medicare network. One note, Part D, prescription drug, is not included and must be bought separately. Eligibility for a special needs plan, SNP, is restricted to those with specific disabling chronic conditions, cancer, dementia, end-stage renal disease, etc., or to those who have Medicaid due to financial hardship. Those plans might cover extra services, including a personal case manager to help coordinate care within the plan's network of providers, and benefits between Medicare and Medicaid. Those SNP plans must cover Part D. But do note that you could lose your plan even mid-year if you no longer meet the financial or medical conditions. So to recap, become familiar with the terms of your plan to avoid delayed access to care and costly financial surprises. Advantage plans have been growing over original Medicare. What is better? While original Medicare has set deductible and copay percentage, your liability is open-ended and based on your use of medical services. Should you face an expensive treatment or unplanned catastrophic expenses without a supplemental plan that covers 100% of your liability, or with Medicaid, which may not cover it at all, this could be pricey. An Advantage plan's predetermined share of cost maximum can help members plan ahead of time. With a Medicare Advantage plan, you don't need or even can't buy a supplemental policy. And Part D prescription drug coverage is often included. You'd have to buy a separate policy with original Medicare. Same goes with vision, hearing, and dental coverage, usually included. Along with enrollment, complaints about Medicare Advantage plans have grown as well. Small networks is a source of complaints. No insurance network is as big in the country as the Medicare one. More than 90% of all medical providers accept it. Smaller networks, especially HMO, hinder timely access to care and restrict services to providers who may be subpar, inexperienced, or ill-suited for Advantage members. And those members, especially HMO, routinely complain about delays in getting authorizations, appointments, or treatments. Original Medicare members have direct, easy, immediate access to any provider without any problem or approval. If it is covered under the guidelines, it is paid. Advantage plan penalize patients who go or may go out of network due to those small networks, whereas original Medicare fiercely protects its member. If the provider is not contracted with Medicare, or if an item service is likely to be denied, the patient must be warned with an advance beneficiary notice. Even non-contracted providers cannot bill original Medicare members what they want, but if you have an Advantage plan, they can. And the same delays, issues, denials, errors, rejections, and hassles that plague the commercial, meaning non-Medicare billing world extend to Advantage plans. Original Medicare has a 14-day turnaround to pay claims, but private insurance can take months. Providers complain too about administrative hassles, such as having to get authorization for every single service. about routine payment delays that never happen with original Medicare. HMO providers especially feel pressure from the business model that must restrict care in order to make a profit. As for tips, joining a Medicare Advantage plan may cause you to lose your employer's or union coverage, your commercial plan. By extension, your spouse and children could also lose coverage. This is not the case with original Medicare. Advantage plan insurers are for profit, meaning they use the same financial strategies and tactics to lower their cost and maximize their profits as they do for commercial plans. And it's working. Their profits are up, as might their members' frustrations and costs. And if you sign up for an Advantage plan, it's for the whole year. You cannot switch unless during open enrollment period, mid-October to beginning of December, or within the very first 3 months of your enrollment with Medicare. To conclude, an Advantage plan may be best for you if you are familiar with and don't mind the confusing, frustrating world of private insurance. If you want one policy for medical, dental, vision, and prescription. If you don't really need many medical services, especially out of network, nor often require immediate or urgent care. And if your current treating physicians are already contracted with the Advantage plan you choose. I always advise do visit Medicare.gov for all the details about coverage, prices, plan comparisons you may have questions about. It has all the answers you need and more. And let's not forget, we patients have rights. Insurance companies have a duty to their members, and they are mandates that providers must follow. I so thank you for watching this video. Did you know your likes, comments, and subscribes help this channel grow to reach out to many more patients like you? So thank you.